currently a professor in the Boston University School of Medicine and the School of Public Health. Her research interests are very broad, and they cover, among other things, the development and evaluation of sexual health interventions for vulnerable populations, including racial ethnic minorities, immigrants and migrants, substance-using populations, and women and girls, the assessment of gendered, social, and cultural vulnerabilities in sexual and reproductive health concerns, intimate partner violence, and child marriage, and the identification of immigrant and migrant disparities in health and healthcare access, particularly in the areas of HIV, violence, and gynecologic health. The primary goal of her research is to develop work that can be used effectively to advocate for the better health and well-being of vulnerable populations. Her work involves both domestic and international research and includes studies in the United States, India, Russia, and other countries. Dr. Raj has an impressive list of teaching awards, and when you hear her speak, you'll understand why, and enjoys an incredible international scholarly reputation. She's published 85 peer-reviewed journal articles and 4 book chapters. And she's also on a number of editorial boards, including Violence Against Women, which is based here at the center, and for which I'm the editor, which is why I made such a big thing out of it. Dr. Raj is heavily grant-funded pretty much all the time, and this is very, very impressive. She's funded by the NIH, by NIMH, by NIAAA, by SAMHSA, the CDC, and others. She's currently funded by the NICHD, the major goal of that grant being to develop and evaluate via a randomized controlled trial the effectiveness of a male-focused family planning program for young couples in rural India. And, you know, all these accomplishments, you would think that Dr. Raj would be this very hoity-toity person, and she's one of the nicest people I know. She's wonderful. And her talk today is entitled Child Marriage, Spousal Violence and Abuse from In-Laws, Intersecting Gendered Oppression of Women and Girls in India. So please join me in welcoming Dr. Anita Raj.
Thank you.
Take care of yourself. We'll be in touch soon.
Have a safe flight. Good luck with that. Okay. Hi. Can everybody hear me? Okay. So I'm going to just go ahead and start with the presentation, but I did have, where's Emily? I had 2 pieces that, okay. Oh, it's around. Excellent. Okay. So I'm going to talk today about issues of gender-based violence and disparities that are affecting the lives and health and well-being of women and girls in India. I actually shared with you a couple of pieces that we recently give note to the work that we're doing. And one is a piece that I was very, very privileged to be asked to write for The Lancet, which really speaks to the fact that as India moves forward around universal health care coverage, with support of the people within the country, we want to think about gender equity. And I bring this to your attention in part because I want to really highlight that while these are issues in India, and I cannot deny it, India is a very progressive and forward-thinking nation in so many ways, in so many arenas, and it is specifically because of that forward-thinking perspective that they have, that this is a country where we can actually do work to make the changes that we'd like to see. And the other piece is the Times of India article. I don't know how many of you know, but it was International Women's Day on the 8th. And it's not as well recognized in the US, but I think actually Obama and Clinton and Hillary Clinton did make note of it. And they did a special piece on the kind of work we're doing in India. And it speaks to the fact that it's great to do research, and I'm very proud of the work we do, but it is only meaningful if we can get the recognition of the issues for the masses and to get politicians to pay attention to this work so that we can make the change. So I wanted to share those pieces with you. All right, so I'll go ahead and start. So just a little overview of the presentation. It sounds like a lot, and you'll see that I go quick, and because I'm not going to focus that much on methods. Unless you want me to, and then I can slow down, but I'm really going to focus on concepts. So I'm going to review MV is marital violence. So we typically use the term domestic violence or intimate partner violence. I use the term marital violence because in the context of India, partnership is primarily in the context of marriage. Marriage is almost universal in India, and so the violence between partners tends to be in the context of marriage. So we're going to review the marital violence data for India. We're going to talk about marital violence and the early marriage of girls and how these intersect. Talk about marital violence and abuse of wives from the in-laws. Talk about the marital violence and girl-infant mortality. So these are just 4 arenas in which we see gendered oppression and violence against women and how it intersects with the marital violence issue. And then what does this mean for reproductive, maternal, and child health for India as a whole? All right, a little bit of background on India. Can I just ask, how many of you have been to India? Some of you, I think, may be Indians. Okay, so not very many of you. So a little bit of background on India. So Afghanistan, Pakistan, India, Nepal. So you can see sort of the geographic region of it. It's an interesting issue because South Asia is, India is sort of thought to be a nation with a lot of, it's a developing nation. And while that is absolutely the case, it also has, as far as countries in the world, it has one of the highest numbers of billionaires in the world. The issue of poor versus wealth in India is quite substantial. And in the context of South Asia, when you see Afghanistan, Pakistan, Nepal, some people include Iran in South Asia, certainly Bangladesh, Sri Lanka. With the exception of Sri Lanka, India is the wealthy nation. So in fact, when you see there's a lot of migration, it's rural to urban migration, and there's migration from the South Asian countries surrounding into India itself, because the opportunity in India is actually substantial for jobs, for a better life. It's a population of almost 1.2 billion people. It is only second to China in terms of population level. It is actually more densely populated than China, however. The median age of the country is 26, so it is a country with a substantial number of young people. When you see a median age like 26, you've got a lot of it's a young working society. It is also a childbearing age society largely. Life expectancy is about 67 years. Men are more likely to die at an earlier age than women, but not so dissimilar than what you see, for instance, in the US. The literacy rate is 61%. It's a majority Hindu or Muslim nation. There are a number of other religions. There's Sikhism, Jainism, there's Buddhism, but these are the 2 predominant religions in the country. 25% of the country live below poverty. It's sort of a weird statement, though, because what poverty means, you can't think of it as what poverty means in the US. It will typically mean living without certain kinds of infrastructures and access to sufficient food, which is a very different phenomenon than what you see in the US for poverty. And 70% of the country is residing in rural areas. That is actually changing. I would say that it's maybe, even at this point, closer to 65 to 68%. All right. Let me see if this is right. Yeah. Okay. So what does maternal and child health look like in India? The fertility rate is actually not very high. It's only 2.6 births per mother. Here's the issue. When you have 1.2 billion people and you do not have a replacement fertility rate, which is 2.0, you will have exponential growth. So because of that, the issues are quite substantial. Additionally, if you look in urban India, you will see less than a 2.0 fertility rate. But when you look in rural India, you see closer to a 3.0 fertility rate. So there's great disparity in the country. And there's disparity by states as well. The infant mortality rate, the maternal mortality rate is 1 in 70 mothers will die. And infant mortality rate is 34.6 per 1,000 births. Are you guys familiar with the Millennium? Am I going too fast? No? Okay, good. The Millennium Development Goals, or those of you that may be doing work in global health. So the Millennium Development Goals are the goals at sort of UN goals at a global level designed to improve health of populations for the world. Okay? So 2 of the big ones are maternal mortality and child and infant mortality. And what's supposed to happen is between 1990 and 2015, there should be a 3/4 reduction for nations of focus in maternal mortality and a 2/3 reduction in infant mortality. India is not achieving this goal, and this is really striking because the level of development and financial security in the country has been quite substantial since 1990, and the fact that the achievements are not being made really speaks to the fact that the development and support and the well-being of India is very heavily affecting the urban areas and not reaching rural communities. 47% of Indian births have a skilled birth attendant present, And you see that rural and adolescent mothers are much less likely to have this type of care. So what about gendered risk? So interesting piece about India is that you know, a lot of people are like, oh, isn't that country where you burn your brides and you kill your girls? And yeah, and we had a prime minister that was a woman. What have you done? So, you know, so I want to sort of speak to the fact that, yes, this is gender depression in India, and certainly there's room for change, but I don't want people to walk away from the presentation labeling the country this way, because I am a product of an Indian culture, and you can see so many women achieving great heights in the context of India and coming out of Indian culture. So it's certainly not something that is affecting development for many populations, but at a national level there is impediment to women's success, and it is affected by the status of women in society, but particularly within certain areas. So in terms of representation in Parliament, only 8% of our representation is female. I say "are" because I'm Indian and American, and I just take claim of both. What do you think it is in the U.S.? What? It's not the same. But I felt that, honestly, Diane, I thought the same thing, because I was like, well, it doesn't feel, what do you think? It is higher. 20%? Anybody else? 13%. It's 14%. So while 8% sounds terrible, you know, it's not so much different than what we see in the U.S. Yeah, well, you know what? What's been really fantastic, or at least from my perspective, fantastic about Hillary Clinton having the position she has, is that she's been going to the UN and being like, yeah, we know. You know, and it's the first time in a long time, I think, anybody who's come to the table at an international forum and said, we've got some issues around women and girls in our country. We need to be contending with the issues as part of a global movement. And that's, I think, really exciting. So in terms of formal education, 41% of women have no, 41% of the women surveyed have no formal education relative to 18% of men. In terms of employment, 99% of men are employed. Now, so for those of you who have been to India, if you go to a restaurant and you're sitting at a table, just the two of, like you and somebody else, how many people are serving you? Four. Four, I would say 6. You know, like, so the mentality around making sure people have opportunity for employment is quite substantial in India. There's a very heightened awareness of this. That awareness does not spread to meet the needs of women's employment. So a big interest of mine is marital status, and this is just generally speaking. You can see that by 24, about 50% of women are married for the country as a whole, whereas for men it's about 18%. So we do know, and this is true in the US, that women tend to marry at an earlier age than men. But the differential is much more substantial in India than you see in the US, for example, but also other countries. Infant mortality. What do you notice about this? It's not substantially different. Girls are more likely to die in the first year of life than boys. Is that true for the US? Is it equivalent in the US, boys and girls? Does anybody know? Exactly, and in fact, one would suspect higher, because I can say this because there's very few men, so I can't get in real trouble for this, but they're wimpier. You put an X and a Y together, oh, were you going to say that? When you put an X and a Y together, there's more likely to be recessive genes, that there's greater vulnerabilities to things like pneumonia, people have said. So in fact, yeah, the fact that we're getting this, although this isn't a substantial difference, this cannot be explained by physiology. Okay. All right. So now I want to talk a little bit about marital violence. What does marital violence look like in India? About 37% of ever married women have experienced marital violence. This is population-based data. Everything I give you is population-based unless I tell you otherwise. So 37% of every married women have experienced marital violence. 33% said that this has occurred in the past year.